Hi, welcome to the Abort Ignorance Montana Podcast. My name is Tanaia, your host, and on this podcast, we seek to educate, advocate, and heal the culture in Montana surrounding abortion. On today's episode, I have a very dear friend with me named Deb Tilden. I met Deborah several years ago, and we have been friends ever since. She is an incredible advocate for the anti-abortion cause, and she has her very own post-abortive story that she's going to be sharing with us today. Deb, I'm so grateful to have you on. Thank you for being here.
It's an honor to be with you.
Wonderful. So I'm just going to share Deborah's official bio with you real quick, and then we are going to just launch into her story. So she is, in addition to, I said, a dear friend of mine, she's a pioneering voice in changing the narrative about women's healthcare and abortion, invading the status quo and propaganda of the abortion on demand movement. Deborah is a keynote speaker, advocate, life coach, consultant, and citizen lobbyist. She is a co-founder of S.M.A.R.T Women's Healthcare that launched in spring of 2016, splashing on the DC and national scenes to transform public policy. She says we need bridging dialogue that removes labels and divisive language, but instead focuses on true, holistic, science-driven healthcare relating to the risks and complications and causal links of abortion. Deborah shares from her own personal abortion experience and the long and winding road back to wholeness out of the twisted and tangled lies of the abortion industry. Since 2003, she's been walking alongside others who have experienced a past abortion or been part of one on a journey to wholeness. She believes collaboration and connection are two vital keys to unifying us and standing for truth and transforming our culture for better public policy in women's holistic, science-based healthcare that builds up, empowers, and ignites a movement and protects babies, builds marriages, families, and society. So that's who we get to hear from today. So Deb, I'm just going to let you share with us wherever you want to start your story and your journey of just how you ended up here where you are, being an advocate for healing as well as on the healthcare side. And so just share with us what is your abortion story?
Well, Tanaia, thank you for having me again. Never in a million years would I have thought that my abortion in 1980 would bring me to spaces like this. What a wild ride. And, the thing that really is disturbing that I see today, and I know for you as well, and so many others, that women are still told the same lies that I was told nearly 45 years ago, 46. And it's really sad that we don't focus on true holistic healthcare. Back then, there's a lot of talk, and there's so many amazing pregnancy care centers today that help come alongside women in that time of need. And that is such an incredibly important ministry and those organizations out there. Those didn't exist when I was in that valley of decision, for newly engaged, newly out of high school, found ourselves pregnant during our engagement period. I would have been 7 months pregnant at our wedding, and nobody had to know. And we only had a couple of people that knew in our lives. And the only advice that we were getting was, well, for us, for one, I had grown up in the church, and my parents and my fiance's parents, we had decided we were not going to go to them. So the only real advice we got was friends who pretty much just said, well, we'll help you get an abortion. We'll take you. One of my best friends took me there. The week that, or the day that actually took place, I was lying to my parents even then. So these are things that are it's such a tangled web. Oh, what a tangled web we weave if at first we attempt to deceive. So my parents had no idea. They thought I was going to the beach with my friend.
And you were 17?
I was 18. Just graduated from high school. Yeah. Had just turned 18.
Just turned 18, but you were engaged?
Yes.
Okay.
And found ourselves pregnant.
Wow.
I still lived under my parents' roof. I still lived at home. And told my parents we were going to the beach.
Mhm.
She took me to the Lovejoy Clinic in Portland, Oregon.
That was the name of the abortion
That
clinic
was
there?
the name of the abortion clinic. There was no
Wow.
love or no joy.
Wow.
Yeah, there's actually a street, Lovejoy,
Okay.
and so and really from that day forward, I mean, it was life was a blur. They do not tell you. The room was just full of women quietly sobbing. They basically shushed you. The Most of the curtains were down. It was very dark. It was a dreary day. And they really just tell you, just be quiet. They don't want noise. They don't want anybody crying. And the room was lined with just beds. And you pretty much just sat and got moved through the process until your turn came up. And they, put you through that process. And you are not the same person walking out the back door. And in fact, it's an alley. The clinic that I went to, you walk through the front door like you do with a lot of medical offices, but you don't go back out the front door. You go out the back door through the alley. Whoever is picking you up picks you up out in the back alley.
Wow.
And that night, well, once I found out I was pregnant, my fiance was actually king crabber up in Alaska. We were kind of high school sweethearts when we first met. I was 15 when we met. He was
Wow.
19. Um, and we just dated for quite a few years. Um, and then that night he called me, but that was the only time in 23 years that we talked about that day.
Wow.
Little did we know, they just tell you life can get back to normal. It's no big deal. I literally went into just, I just felt numb. That's kind of a word that because emotions shut down. I mean, I was very musical. I was very poetic, wrote poetry, but there was this space of time in my life. And I will say that really from the time that I had my abortion to when I went through my healing 23 years ago, all of that and that didn't really come up in my thought processes until much later when I was going through different stages of healing. And when you go 23 years not talking about it, there's a lot of things that happen. I fell into just a lot of drug, alcohol addiction, um, and being underage too. I mean, that was so much of what played out. Um, just finding things to numb myself, exercising I starved myself. I exercised 2 to 3 hours a day. It was like busyness. I had to stay busy. I lost a couple of jobs along the way. I was a hard worker. I mean, it was this space of time that just was not characteristic for me. I grew up in a good home. Sadly, I didn't feel like I could go to my parents in this space. Um, but we just partied. We did get married that next spring, but everything in the relationship, so much in the relationship had changed. We nearly divorced that first year. Um, the and we just I have a praying mom, praying grandma, and I feel like those are the things that helped us even though I don't think we attended church except for maybe Easter or Christmas or special holidays during an entire 7 year period until our next child came along. And we were like, we got to figure this out because we were deeply involved in partying. Um, Anything and everything that got offered, we took it. Um, and so thankfully, we got involved in church during that time. But even then, nobody was talking about it.
Yeah.
We had this elephant in the middle of the room for so many years.
Wow. So it's
Nearly,
very taboo to talk about.
well, it was really not talked about at all.
Okay.
Um, it wasn't a subject. Abortion wasn't something that was talked about in church. Even though we were involved in church ministry, it was something that the leadership did not know about. There was one counselor we saw many years ago, probably when our oldest was 10. And he actually asked us, because of the issues that we were dealing with in our marriage, he asked us if we had, and this just shocked us, if we had murder in our family, if there any, and we're like, we look, we're thinking about who in our family maybe had ever been a part of that. And we were like, I don't know. And then he said, have you had an abortion together? And that was like total wake up call.
Wow.
And he started to address some of those dynamics. And then we moved, and there was just a lot of different dynamics going there. We moved to Nevada. I ended up going through a healing ministry it was something that my pastor and his wife recommended for me and another gal that we had been talking about this experience between the two of us. And we thought, let's start a support group in our church for women who have had abortion, just so we have a support to talk to each other about that. Our pastor sent us to the training at in Van Nuys, California, at Church on the Way. That was Jack Hayford's church. The ministry was called Beauty for Ashes. And Holy Spirit absolutely just took my breath away that whole weekend. I did not stop crying the entire weekend. And just the ministry of reconciliation and healing, and just that experience with Jesus at that weekend retreat. And every year after that, I went 4 years after that, for 4 years in a row, and I took somebody with me. The final year, they opened it up to men. So I asked Michael if he'd be willing to go, and he was. And that weekend was our breakthrough weekend. 23 years had gone by. We had never talked about it. He supported my healing, because he didn't think he needed it. But when they opened that up and those discussions came out, and there were men worked with men, there were 75 women and 7 men at this event. And the men had their own work. Men process things differently. So he had his moment. And then each night they had homework for us to do. And that was the first time that I ever heard my husband say to ask forgiveness for that he did not stand up for us against the abortion industry, against ending the life of our child. And that was dialogue that we had never had before. And so that healing retreat was so powerful. And then soon after that, I shared my testimony on the steps of Sacramento's Capitol, the Capitol steps of Sacramento, California. And that was just it, as you know, this process is such a healing process, and it's like peeling the layers of an onion. And I feel like the more years that go by, more things kind of have to be dealt with, because there's a lot of, scientifically, it's been shown the different secondary issues that come up within, because abortion truly it's a fracturing of the soul. We as women are not meant to end the life of our own children growing in our womb. We have a neurobiological connection with those babies. And when we treat it so callously in culture, and I see it every day, and it breaks my heart to see the lies women are told all these years later, when we know what we do, and the cover-ups, and the fact that the abortion doctors, I back up, I don't call them doctors, they're abortionists. The fact that they're trying to claim undue burden in having to tell women the risks and complications, That to me is medical malpractice.
And you've experienced that firsthand from when you were,
Absolutely.
yeah, wow.
And when working with, so soon after that, in California, I started working with the pregnancy care center there in the abortion healing and recovery space. So I did that for 3 years, and then God moved us back to Oregon, back to my home state. And I feel like I came back a completely different woman from when I left in 1998. And God's so funny, where it was 7 years to the day that he took us out
Wow.
and brought us back. 7 years to the day. Seven is a very significant number.
Yeah,
It's a
number of
number of
perfect.
perfection. It's like he did the work he needed to do
Wow.
in me, in my marriage, in my family. But the things that we did discover were the ripple effect on our parenting, on our marriage for one, but on our parenting. When you look at abortion for what it really is, it is a fracturing of your soul. We're never meant to do this. There's a teaching called theology of the body, and it is out of the Catholic Church, but it's so beautiful of how they talk about how God designed us to be. And when we step out of that, there are consequences. And I lived that for so many years. And then when you don't have anybody talking about in the church, being in church leadership, but in walking with other women, that was so eye-opening. The very first group that I co-led in California, including the co-leaders, there were 14 of us. That was a large group. You don't normally do that large of a group, but it was about 13 weeks long. And to hear the women unpack their story and the similarities, like for one, I had no idea why I was so depressed on Mother's Day for years after I had my children.
Yeah.
But it's one of those the anniversary grief. And for me, our daughter would have been born around Mother's Day. So it's kind of a double whammy, but I never connected the dots.
Sure.
But when I sat in that group with the other women, 100% of the women talked about Mother's Day grief, anniversary grief,
Wow.
and depression around the date that they had their abortion,
Yeah.
and then the date that would have been actually the birth date of their children.
Wow. And the abortion clinic doesn't tell you about that, do they?
They don't tell you any of that. Like I said, we have a neurobiological connection with our children. So in doing that, working in the abortion healing and recovery, like I said, God moved us back to Oregon. Just continued to do the abortion healing recovery. And in 2000, that was in 2005. And I just got more involved in speaking on the colleges and universities and sharing our testimony, and my husband sharing his story. People are very interested in hearing what men have to say about this issue because not a, I would say in the last 5 years that's changed a lot,
Okay.
but it is such a vital piece of the puzzle for healing the culture of being able to have men share their stories as well. And we we did that a lot. Um, and in there's so much as we seek the Lord in understanding what abortion does to you, and then peeling back the layers, um, and really being able to relate to the students on the college campuses and in the student youth groups.
Yeah.
They're hungry for this kind of information to be able to understand, whether it's in church or outside of church,
Sure.
but talking about the truth of this issue. Because when I am with a youth group, but now I do it with adults too, everybody has a belly button. We all have a belly button. Our belly button was our connection to our mother in the womb. And that connection gets cut when the child is born. But that neurobiological connection that goes on during that pregnancy, even from the very, very beginning, those mothers, scientifically, they say that you carry the DNA of every child that you carry in your womb
Yeah,
for
that's
your
really interesting to
lifetime.
say. I think our listeners know I was recently pregnant. I have a 6 month old, and I kind of nerd out on some of this stuff, especially in relation to abortion and pregnancy. And so I actually read a textbook. Essentially, it was a textbook about the connection and the development of the baby. And that was
Mm-hmm.
something, and it wasn't from a Christian perspective, like it was just
Nope.
science based. And it talked
Mm-hmm.
about how, like you just said, our DNAs are swapped between
Mm-hmm.
the cells. They're actually swapped, and like you said, they stay in the mom's body. So I had never ever have a connection to my son,
Yes.
and it talks about the hormonal changes, and that's why I
Yep.
was thinking, when I was early in my pregnancy of and just following that developmental stage, if that was to just get cut off, just how, I mean, hormones are already outrageous when you're pregnant and they're
Yes.
fluctuating. And to have that be growing and they're shifting naturally like they should, and then to just stop that process, that chemical shift alone would cause depression, let alone
Right.
the fracturing of the soul that you were talking about, but just the chemically in our bodies. That is not good for women to have that
Right.
just suddenly stopped. And of course, that's going to cause depression. And doctors or abortionists, no one tells women. Sounds like I didn't tell you about, there's
Right.
going to be this chemical cutoff in your body and you're going to have some hormonal fluctuations. Like at the minimum, they should be told that, I would think.
Right.
It's crazy. But yeah, continue your story.
So just in once we move back to Oregon, doing more and more of the sharing testimony, I went to an event and heard a medical lecture with a Dr. Angela Lanfranchi about the breast cancer risk.
Oh.
And when I started just unpacking that, and she was explaining all of the reason for the abortion breast cancer risk,
Mm-hmm.
that was a piece of the puzzle. Those were things I'd never heard,
Yeah.
really, ever. And
Right.
I will say that was 2013.
Was that
And
fairly
I
new
just,
research?
what's that?
Was that fairly new research at the time, or was that, do you know?
That was new research, worldwide research. And she had already been part of publishing a book called Complications.
Okay.
And it's a compilation of more than 600 worldwide studies of the physical and psychological harm of abortion on women. So you
Wow.
have the breast cancer risk, preterm birth, premature birth tied together, and then the mental health and suicide increase. Um, and what we often hear from those who don't agree with us is that, oh, that's bad science. And I just tell people, well, don't take my word for it. Read the science for yourself.
Right.
And if we will step back from the political lines
Yeah.
and simply look at evidence-based,
Mm-hmm.
science-driven healthcare for women, when we are doing anything against the natural, normal progression and development of the female body, if we're giving women pills, potions, procedures for their body, these are some of the things that are linked. This is why whether it's the abortion, the chemical abortion pills, Depo-Provera, all of these things that are tied to reproductive medicine in women's health care, everything has a side effect.
Yeah.
Anything that you do in an adverse way of what the body is naturally doing, whether it's the pills, whether it's an abortion, your body has there is a natural life cycle
Mm.
we all go through, our bodies go through and develop. And after meeting Dr. Lanfranchi, I started lobbying. I started going and talking to um, I basically shared my testimony with legislators, and I shared that book, Complications. And that started in Oregon and Washington. And I will say too, this had been after quite a few years of going through healing. To be able to go public, to be able to go before a hearing at the legislature,
Yeah.
um, we were able to defeat in a hearing in the state of Oregon the attacks on the pregnancy care centers.
Wow.
I had a 7-minute speech, and I shared part of my testimony. I shared worldwide research.
Wow.
And we were able to defeat. And then there were women who were actually 7 months pregnant who were giving testimony. So we were able to defeat that. And so when I started doing the lobbying, it was, again, I had one little brochure, I had the book and my testimony. And then, like you shared in my bio, going to DC, that was a whole nother thing. It was like, I'm a woman on a mission with a fire in my belly. I simply want women to know, abortions have been going on for a long, long time. And it's basically child sacrifice. It's been done in different forms over the centuries. But we need to inform women of what they're getting into. So what we focus a lot on is the informed consent, full disclosure and informed consent, and no taxpayer funding of abortion. I paid for my own. People find the money to, and when we make it so easy, and we claim that there's no consequences. That's why, to me, when I hear these abortionists say that it's an undue burden for them to have to tell women, they know there are consequences. So we're just, and I know government doesn't fix everything for sure, but public policy can move us in the right direction of educating the public of just how much abortion is not healthcare. Hindsight is always 2020. The lack of information I was given as a young 18-year-old, scared. They knew I was scared, but they just said, well, nobody has to know. So we can keep your little secret. Nobody has to know. I knew that was my daughter. That was my child whose life as my husband and I have healed and gone through that healing and come full circle. And even, like at Christmas time, we actually put an ornament. Sorry. We put an ornament on our Christmas tree. We chose not to have a relationship with that child. But through the healing process, it's almost like what I'm doing now is God giving me the opportunity to nurture that relationship, not only with my husband, just for us to be able to talk about it, to talk about her, but to be able to just acknowledge this was our child. This was not a blob of tissue, not a product of conception. She was a human being at her earliest stage of development. And she was dependent on us at that time. But unfortunately, we did not have wise counsel around us. We didn't know the things we know today. So that's a lot of what motivates me to get out and do what I do. And it's crazy to me, the things, believe me, I've been a deer in the headlights many times where I wanted to run far and fast away from, because this is not an easy subject, as you well know. Anyone listening, it's not an easy subject. But again, I always ask, let's step back from the political battle lines and let's focus on true humanity. Let's focus on purity in a way that, not just sexual purity is the start of it, but the mental, what we think about, what we think about, not only ourselves, we live in a culture that is just like anything goes.
And we think that's healthy and whole and brings freedom, but really some good rules around some stuff, some guidelines of how to live. And I mean, abortion was meant to be safe, legal, and rare. There was parameters around abortion, and it's legal, but it's not rare, and it's not safe, which I think your story showcases. It's not safe for women mentally, emotionally, spiritually, physically. It's not safe for them to be having abortion. That's not healthcare. It's harmful to women, actually.
Well, and I feel like a lot of what you're doing too is we're speaking for a lot of those women that do not feel like they can come forward. And when I go speak or share testimony in a legislature, whatever, the amount the people come up and they thank us for doing what we're doing because they say, I couldn't do. And, I offer encouragement to them because I said the same thing. I never would have thought I'd be doing what I'm doing. Being in the United States Capitol, sharing my testimony with hundreds of between the House and the Senate, I've probably shared my testimony 500 times to legislators and to let them know why I'm there and how important public policy is to, and unfortunately when we now know, most people didn't know how abortion was built into Obamacare
Right.
and um, or the Affordable Care Act. But one of the things that we saw as we analyzed the fiscal impact of abortion, when you look at the lost time for women who go through breast cancer, and this doesn't say that every woman, I want to preface it that just because a woman has breast cancer, let's not assume that she's also had an abortion. That's not the case. However, when you look scientifically and statistically, breast cancer basically has a 10-year latency period. And 1973 is when abortion became legal in the United States. 1983 is when we saw a massive surgence of breast cancer happening in American women. And then the research was happening around the world as well. So this data is worldwide, and people can actually go to Smart Women's Healthcare and look at some of those things. And that information is constantly being updated because I'm sorry, for me, women deserve to be treated with respect, to be treated with honor, to be treated and given the truth about what they are getting themselves into. And there's a lot of things that we can be doing in the public policy arena. Things that we're working on are things like the statute of limitations to give women who are injured from abortion more opportunity, that because a lot of women have their medical records that show that they were injured from their abortion. And
What would an injury from abortion be?
well, I've worked with women who could never have children again.
Okay. Like a physical.
A physical injury.
Yep.
Um, some of those women who they were injured from their legal, safe abortion. This is legal, safe abortions here. They could never have children again. Their bodies were so injured. And for those women, it is a whole nother level of heartbreak for those women to know that the choice they made and were misled in, that there were any consequences. Oh no, it's no big deal. Abortion's totally safe. That's a lie. Abortion is never safe, especially not for the baby, but it's not safe for the mother either. So to walk these women through their abortion healing and recovery, and then to have to, especially once they're discovering this, that they are no longer, and they were not able to conceive, or could not carry children to full term, um, consistent miscarriages. And for these women in their 60s and 70s to have this in their past and know that this is potentially a huge reason why they could not, because of the injury. Some of them do have their medical records showing that. Some of them just know in their heart of hearts because of what they experienced after. Well, and even the chemical abortion pills being pushed right now,
Yeah.
saying that they're safer than Tylenol. Really? Do you care that little for women to make a statement like that? Because early this year, It's now 2026. Back in April of 2025, there was a data analysis of nearly 900,000 women who had taken the chemical abortion pills. They had the insurance record. These were like Medicare claims, Medicaid claims, TRICARE, all of these. So this was actual insurance data, privacy protected, obviously, but they analyzed these women who had taken the chemical abortion pills. They tracked for the first 45 days after taking the pills. 11% of those women admitted for serious complications, sepsis. Some had to have hysterectomies.
Wow.
11% of those women within the first 45 days after taking the chemical abortion pills
Wow.
admitted to emergency rooms.
Wow. And that was 900,000.
900,000 women is where they took nearly, it was like 875,000 women. The data was pulled and they were tracked for that period of time.
So 10%.
So if we had Tylenol with that level of complications, you'd have Tylenol off the market.
Right.
And for them to claim that the chemical abortion pills are safer than Tylenol, that just gets my,
Wow. You get fired up about it.
that's,
Yeah.
women deserve better
Yeah. Yeah. And I
than to be lied to.
And I hear that all through your story of your own abortion experience. There was no information, and it was, you and your fiance, and you, if I heard you correctly, you immediately felt different afterwards. And then
Oh, yeah.
23-year period of just substance abuse and difficulty in marriage, maybe some difficulty in parenting. And when you guys finally realized what had happened, what it was, that you got fired up because you realized I could have been told all of these things. I could have known this. I could have avoided this for my daughter, for my own
Right.
health. And it affected that 23-year period of your life, which includes your kids you have now. And so
Yeah.
it's through your story, you have this passion, not that you need to be, you're not a political advocate just because you're politically polarized or you think you're the only one that's right. But what I'm hearing in your story is you're passionate to help women and to get this truth out of this is not healthcare. It is not good for women. And your own
Yeah.
abortion experience, you experienced that, your husband experienced that, and you have all this data now that shows it so plainly, which is just incredible. I just love
Right.
your passion for that and how it's just weaved all throughout your story.
Yeah. It's been a wild ride. I'll tell you that much. I never, would have thought, again, like I said at the beginning, that this is the kind of stuff I'd be doing.
Yeah.
But I can't be silent. I've been part of Silent No More Awareness. That's a place where women can go and actually unpack their story online, totally anonymously, and be able to connect with and
That
go
was
into a
Silent No
healing and
More.
recovery. What's that?
That was Silent No More.
Silent No More Awareness. Yeah, silentnomore.com. That's one of the places that group of safe women, and that's the other thing I want to emphasize is being a safe person that people can unpack their story.
And we want this to be that place, or we want the people that are listening to be able to know that there's places you can go. You can reach out to Abort Ignorance. You can reach out to Deb. We'll give her information. And there's places to go where you can talk about this and it's not polarized. There's not judgment. Even if you still think that abortion is okay, but you've been experiencing it or you have experienced it, like I think that's so important for people to know those resources that you have, that there's places to go where they can talk about it and they can help heal from it themselves.
Mm-hmm. Well, and we don't often talk about the spiritual aspect
Yeah.
of whether or not someone's religious or not. We live in a spiritual world. We have a subatomic quantum physics level of the universe that we don't see. We don't see the baby in the womb except through an ultrasound. That little layer of skin and the uterus, the uterine wall, that little bit of space. And the ultrasound is what has given us a window into the womb. And, and there's been doctors who do surgeries on babies in the womb. They fix a heart condition or and the other thing I want to mention too is we hear so much of the rhetoric from the abortion industry that we need abortion to save the lives of these women. These
That's
women's
not true.
lives are threatened
Yeah.
by this baby. Well, I've worked now so I've been in this sphere for 25 years, but in the last 5, I've met a lot of maternal fetal specialists and people in the restorative reproductive medicine space. And one of the things I hear over and over again to really, I say, counter these this claim that women need abortion to save their lives.
Mhm.
Because if it's a, fetal anomaly or whatever the reason is,
Yeah.
what I hear every single time, and these are even sometimes, these are not always pro-life doctors. These are just heart heartfelt, holistic healthcare providers.
Wow.
And they will say there is never a time where we actually have to kill, dismember, maim that innocent child in the womb to save the life of the woman. It can actually put her life more at risk. However, there are times when those babies have to be delivered early
Yeah.
and they may not survive. That is a real factor. But instead of killing the child in the womb, and this is very different than a spontaneous miscarriage. Those are, it's amazing at how confused women have been led to believe so many of these false narratives. And I think the left wants to create a level of confusion and have people misinformed. But these doctors will say these babies, if they aren't going to survive, why don't we let them be born into the loving arms of their parents? It's hard. These are the hard things in life. There is no denying that. But for this child to be born into the loving arms of a care provider, whether it's a nurse, a doctor, one of the maternal fetal specialists, because it is hard for a woman and a man, a marriage, or a single woman. You know, there's so many stories. The stories are so vast. People matter. Those women matter. The fathers matter. The babies matter. But when we treat people with such a callousness that, oh, we need abortion to save the life of a woman, yet what we're doing to this child does not help her.
No. You don't have
And
to grieve either way, but it would be so much more natural to grieve the death of a child, as horrific as that would be, the death of a
correct.
child born alive. But how much more natural is that than having to later grieve that you chose to help kill your child before they were even born? Like that is a whole different
Yes.
level of grief to have to go through. So neither one is great for a parent to have
No.
to go through, but it's much more natural to grieve after that baby is born.
And these are her, and I think we just need more within the medical community because
Yeah.
I find that some hospitals are better at this kind of care than others. Obviously, abortion clinics are not
Right.
for their number one business is abortion.
Right.
When you think of like Abby Johnson's movie that will be coming out hopefully this year, Unthinkable, the stories that are coming out of those clinics have nothing to do with women's healthcare, honestly. And
Exactly. Yeah.
it's like we're created in the image of God.
Yeah.
Women are created to nurture and bring forth life. Men are created to protect and provide for women and children. And you look at society and it's a bit schizophrenic.
Yeah. Yeah. Mixed up.
But it's like, bringing things back to humanity and when it comes to, and one thing I see oftentimes, if you haven't had the opportunity to sit and hold a teeny tiny baby,
Mm.
m- more people I think might change if they actually, I mean, you're a new mama
Yep.
and it's just like
Nothing like it.
incredible. I'm a new grandma and it's so amazing to be able to watch. Human development is from conception to natural death. Let's look at how we can complement and bring, like I had said, a holistic approach to healthcare. One of the things that I'm having a whole lot of fun getting more involved with is the work that the Maha Institute is doing. Really focusing on and I know there's a lot of topics. There's every healthcare topic under the sun being discussed right now. But what they're looking at is evidence-based, science-driven healthcare. And we are bringing to the table this very issue where we need to be having, just like with the chemical abortion pills, the FDA, the FDA needs to be putting, at the very least, the REMS back in place for women to have a medical examination. They're not testing women to see if they have an ectopic pregnancy. If a woman takes the chemical abortion pills and has an ectopic pregnancy, that's an emergency visit where if they don't get to her quickly, she could die. And what some of these women are being told not to tell the emergency room doctors that they've taken the chemical abortion pills. That's medical malpractice right there for any medical professional prescribing those drugs, to tell a woman to not, if anything goes wrong, do not tell the emergency room doctor or the medical professionals there that you've taken those pills. They need to know. That's time wasted. That's potential. I mean, these women are hemorrhaging. And some of these women can never have children again. Some of these women have to have a hysterectomy. I mean, and it's just, to me, it's heartbreaking. This is not how we treat women.
I love your passion, Deb, for all of that. I think it comes from such a pure place of you went through this, you experienced this. And for you, the part I love about your story is that it wasn't just you, it was you and your now husband. And I think that's such a rare story where you hear from someone who, you know, fiance and the fiancés got married and they had an abortion, that they actually stayed married. They got married despite that, like that you guys did, and you stayed married. I remember hearing that for the first time and just thinking it was so incredible that you guys went 23 years and somehow stayed married despite that terrible thing. And your
elephant in the middle of the room, we called it.
Heartbreaking thing.
Yeah.
I just lived with. But then you both received healing. And from that healing, you both love your daughter that you never got to meet so much that you're here doing all of these advocacy things. You started Smart Women's Healthcare for science-based, evidence-based, holistic women's healthcare. Because you want all this wonderful knowledge you're sharing. You want it to go out so that other women can hopefully be intercepted and hear that and say, oh, this isn't good for me. This is a lie. And I just think it comes from such a pure place in your heart. I just love it. And I hope we get to hear from your husband at some point as well. You mentioned we could do that. I think that would be incredible to hear his side of the story. And I just love all that you're doing, all the work you're doing. You're such a wealth of knowledge. So tell us a little bit about the organizations that you do have right now, how we can get involved with you, how we can help, anything.
Well, I do life coaching, and that's kind of the passion that came out of a lot of what I was doing, of helping people. I didn't see a purpose for my own life back when I was pregnant, nor did I see a purpose for my child. If people can understand that their life has purpose, sometimes we aren't even going to get ourselves into some of these situations that we get ourselves into, like we did. And then out of that, Smart Women's Healthcare. If you want to find out some of this worldwide science, go to smartwomenshealthcare.com. Smartwomenshealthcare.com. And that we just are working with a lot of different researchers, medical professionals. We have a resource page. It's actually a collaboration page. There are organizations that provide continuing education credits for medical doctors, for psychologists, counselors, so that you can actually become better educated in how to care for your patients, to understand this holistic approach to women's health care. And we also have listings of shepherding homes and pregnancy care centers Abortion Healing Recovery Ministries. We met at a Save One training.
Yes, we did.
And so that, I mean, that was when we first met. And, God just wants to heal. He wants to heal the world, really. And abortion, unfortunately, is a plight that has been such a tragic space in our world and treated so callously and so poorly. And then this year, 2023, my husband and I and my daughter started Guinevere Rose Foundation in honor of our daughter. And that is actually our nonprofit, Guinevere Rose Foundation. Yeah.
And that's what you named your daughter, right? Your daughter
Yes.
that you guys
That we aborted. Yeah. Um,
so there's now a
so it's
nonprofit.
really been this thing where it's been able to really nurture, um, and we want people to understand how much abortion affects the woman, the man. It's a relational decision. Abortion is a relational decision. We chose not to have a relationship with our first child. Yeah, we were young, but we would have been fine. And you mentioned how our marriage, we're actually coming up on our 45th
Congratulations.
wedding anniversary this coming March.
And stronger than ever, right?
Yeah, I would say that. I mean, we've definitely been on a ride of our life. But to be able to just, it's almost like we're just this wide open book. And it's just, life has choices we make. We make mistakes. If I had one do over in this life, that would be it. If God said, I give you one.
But you're getting a lot back for that. I mean, you're holding that whole industry accountable for what happened to you and your daughter, and you are
Well,
not
we are, and it's a movement. My daughter and I are actually writing a book. She's writing it. It's fiction. The um what it would have been like to grow up with her big sister. So when we talk about the ripple effect, the siblings that later on were carried in the same womb that their sibling died. And that's a reality that my husband and I have had to face. We can put things in a box, we can put it in a little Pandora's box and think it's not going to affect us. These things as human beings affect us. So really, Guinevere Rose has just been about this healing, hope, and wholeness, bringing people back to wholeness with these decisions that we make, because there are missing members of our family. And the amount of stories I have heard over the years from people, whether it was a grandparent who forced their daughter to abort their grandchild. I mean, that's another thing that a lot of parents, one thing I would say to parents sending your children off to college, please don't tell them to call home. Don't tell them to take care of it. I have heard so many stories over the years, and it's such a heartbreak later on because some of these families have no grandchildren. The only grandchildren that these parents and grandparents, and some of them obviously did not know, but those who did or forced, I encourage them to go into healing because a lot of times there's areas in their life where things are falling apart and things end up at the same place again. It's like you think things are fine, and then you come up against this plexiglass wall and you can't figure out why. I mean, that's what I dealt with for 23 years, not understanding why I dealt with depression around Mother's Day, why I dealt with depression around October. My abortion was in October of 1980 and she was due in May. And I didn't know. Now I know, and now I understand why even. And I just want to prevent so much of that pain that so many millions of women, men, families have been through. I believe that our nation can heal through the healing from abortion because it is a relationship fracturing of the soul of the woman And depending on the dynamics that was going on with the man, that man is part of that child. And when we look at the spiritual dynamics of the world, of the universe, there is a tie.
Yes.
People can accept it or deny it, but when you look at the quantum physics subatomic level of the world that operates around us and the spiritual atmosphere that works around us, and that has been at the core of everything we do, is wanting to see people engage with one person that can help them come to the saving knowledge and the truth and the forgiveness and the wholeness again. It's a journey. I feel like I feel like Guinevere Rose Foundation is really kind of this full circle journey back to wholeness that I never thought was possible, honestly, for me to be able to do. And there is a loving, caring, compassionate movement. You're part of it. I mean, there's so many amazing women and men. Um, and I just hope any pastors that are watching that just teach what the word says about life. I set before you life and death, choose life. The word says to be fruitful and multiply. That is what we should be teaching people. And unfortunately, I don't hear that a lot from leadership. There's some amazing pastors out there that do. But just this is just universal truth we're talking about of the value of human beings.
And lived experience of how it has affected you, people that you know, your husband. I
Right.
love that you're making the point that abortion isn't just affecting women, it's men, women, and families. That's abort ignorance. That's why I started Abort Ignorance, because I realized I had people in my past that had abortions, and that meant that there was people that are not in my life and nobody talks about it.
Yes.
And that's
Yes.
part of where this all started for me. And yeah, the men, women, and families thing, we made the point on a previous episode that if 1 in 3, and that's probably a low number, or a high number, but if 1 in 3 women are experiencing abortion, then 1 in 3 men, women, and families. So if you look around anywhere you go, that's pretty much everybody in some way has probably
In one way, shape, or form. The ripple effect of
whether
it.
they know it or not, like there's
Right.
that ripple effect. And that's huge. So that's our heart in all of this. That's why we're having you on here. That's why we're going to keep doing what we're doing on whatever, everything you're involved with, everything that I'm involved with, because it's not about being right. It's not about winning
No.
the correct policy or having who you want in office or your body or your choice. We don't care about the semantics. We care that this is it's affected us in our
Yeah.
past. It affects our friends, our families, and women that we don't even know out there. There's such a
Yeah.
part of, we want there to be a space for healing to come forth and that people can talk about this. Men and women can talk about this subject. And so I just
Right.
love all the resources that you have. You have life coaching, you have Smart Women's Healthcare, that's a wealth of knowledge. You have the Guinevere Rose Foundation that's promoting just holistic healing. I love all of that. Anything else that we should know about what you're involved with, what you're doing, anything?
Um, I just, we can always use prayer. I don't want to be more noise. There's so much information out there. People are overwhelmed. And, we just came through the holidays and, there's a lot of people that are just very lonely. And some of them have this in their past, some don't. But, we were created, even if someone's an introvert, they're still created for community. God created us to connect. And yes, people that are more introverted, they like quiet space. They rejuvenate through quietness. Um,
We still need people.
but we still need people. We still need people. It's almost like one person that is there for us to listen. And I just, I'm very hopeful for 2026 for so much of, and there's a word that a lot of us have been talking about, convergence, the convergence of many who have the lived experience that we've been talking about tonight is so important. There's a marketing term, facts tell, but stories sell. And everyone has a story.
Yep.
The stories that women deal with, you know, in this very space, they're not always in very good situations. But we need people who might be willing to open up their home, a shepherding home. That's one of the things that's on our collaboration page. Just one young woman that you know.
There's always something you can do.
There's always something that we can do, whether it's the pregnancy care center, whether it's donating to, clothing or diapers or formula, or I would say for one, find the pregnancy care center closest to you, or some of them even have like an Amazon baby list that you can actually go on and order stuff and have it sent directly. Um, just get involved and, be there for, one of the number one reasons why women choose an abortion is because of lack of support.
Wow.
They
That's
don't
a
have a
very simple
community.
thing. Yeah, that's a very
Some of
simple
them
thing.
are in violent situations. They've never learned, they didn't learn, they didn't have a mom that taught them how to mother.
So nurturing
There's a
instinct.
lot of, a lot of the pregnancy care centers, they give life coaching, they give life skills coaching. The shepherding homes offer learning life skills. Um, and it's just really being available for people in their time of need.
Love that. And anybody can do that.
Yeah. And being involved in your church, start a group in your church, or
Yeah, for postpartum healing.
support adopt the pregnancy care center in your community, or start one.
Yeah,
That's one of the solutions that we need,
yeah.
and help build up families and help families thrive.
And have babies. That's a good way to help.
Yeah.
If you're in that
Even Elon
situation.
Musk is saying have babies.
Yeah. Oh my goodness. I love it. Well, thank you
Yeah.
so much for all you're doing. In closing thoughts, what is one thing from your story, your post-abortive story, if you had one tidbit that you could share with women that are considering that or that have gone through that? What is just one key takeaway that you would love to share with people in that valley of decision right now?
Don't be silent. Don't sit in silence. There are people. If you reach out to me, reach out to Naya. If you're in that point of decision, there is help for you. There is help. Whether or not you are making that decision to choose life for your child, there is help. There are so many resources to help you. And then finding a community. And if you have gone through this and have had an abortion yourself or been part of one, whatever that ripple effect is, don't be silent. Please don't sit in silence anymore. One more day. Um, share your story, because that's one of the things, because a lot of times that all of those thoughts and everything that we did and the mistakes we made, they ruminate in our head, and it goes over and over. And it's being able to find even one person. There's a lot of awesome, and that's one of the things on our website, Smart Women's Healthcare, under the collaboration section. If you want to just do it from your own home and be part of an abortion healing and recovery group, there is a whole number of them. There are some that are Christian and non-Christian, they're secular. If that is something that you feel, um, you know, people have been hurt in the church. Sadly, it shouldn't be that way, but it's the reality of people. And just again, just don't sit in silence. Talk to somebody, reach out, and know that you are loved. God loves you. And that's not just a religious statement, that's an absolute from the core of my being. I don't believe I would be here today if it wasn't for God's love, grace, and forgiveness, despite some of the horrible decisions. This is just one of them, that I've made in my life.
Oh my goodness. I love that. So it's smartwomenshealthcare.org, is that correct?
.com,
.com.
smartwomenshealthcare.com. Yep.
Awesome. Wonderful. So smartwomenshealthcare.com. or abortignorancemt@gmail.com if you want to email, or abortignorancemt.com. There's resources on both of those locations. So if you are someone out there that is in the valley of decision, or like Deb was saying, you've gone through an abortion, whether you're man, woman, sister, brother, whatever, men, women, and family, where you fall into that category, reach out for, just to tell your story. Like she said, just get it out. That does help. I come home from, days of meetings, and I just blab it all to my husband just to get it out of my head. And that alone helps. So even
Yeah.
something that's way more serious, like an abortion story, it just helps to talk about it. So reach out. Those are some resources for you. If you want to connect with Deb, you can find her at smartwomenshealthcare.com. She has life coaching. She also has the Guinevere Rose Foundation that she's doing. There's books coming out, so make sure to follow Deb as well. And as always, if you have questions, comments, thoughts that you want to share with us about this episode, maybe questions for Deb or for myself, email us at abortignorancemt@gmail.com. Share this episode with a friend. Make sure and subscribe so you get future notifications. And like I said, we just want to hear from you. So any questions or comments, reach out. Deb, thank you so much for being on tonight. We are so grateful to have you. We love the story that you shared. And I'm sure that we will have you on again in the future, because you are a huge wealth
I'd love
of
that.
knowledge. And yes,
this is a conversation that needs to be talked about.
And we can have it from 1,000 different angles. And
you bet.
Yeah, so much to talk about on it. So thank you for the pieces that you shared tonight, and for your care that you have for women that have gone through this, and just your courage to share the story with us. So I can't wait to have you on again. And we're very grateful that you were with us tonight.
Thank you.
Thank you. All right. Until next time, guys. Thanks for coming on.